we've got the whole body MRI, and it targets essentially the whole body. Are there other areas that you would supplement or augment that scan with that maybe the initial scan is not as sensitive to?
Well, there's a couple of areas of the body that are particularly dense, and the testes, the spleen, and lymph nodes. And in those areas, we know that they're dense and we know they're going to show up on our diffusion scans. So this is where, if for male patients, the prostate in particular, the diffusion level that we need to go to is double to triple the amount of suppression that we need to detect cancers in that area. While the whole body diffusion is great at looking metastatic spread of the prostate tumours, a dedicated scan of prostates, and for women maybe breasts, especially if they have dense breasts, is a really useful comprehensive tool to be able to get the full picture.
And can you break that down for me just a little bit more? Can you tell me how we do those extra scans, those extra detail scans in those extra organs?
The whole body setup has got surface coils over the whole body. When we have a look at a specific organ, we have coils that are shaped to the shape of the organ if possible, but something that's a lot more focused into that area. So say for breast imaging, we have a specially shaped breast-shaped coils that the ladies lay into, and then we look at diffusion levels much higher than what we would use on a standard scan to go through the dense tissues that we know that are there. So we can take away things that have a little bit of ambiguity and be a lot more certain about what is likely to be cancer versus what's not likely to be cancer. With dedicated scanning as well, we use contrast, and we use it in a way of perfusion. So we'll inject some contrast and then we'll scan multiple times in a short period of time, and we can watch the flow of contrast go into the organ and then wash out again. And we can look at normal tissue versus cancerous tissue to show what's most likely to be something of concern versus something that's a benign tumour. In the prostate, we'd often go to B2000, double what we'd normally use in whole body diffusion, to be absolutely certain and even above that. It's also surrounded by bowel with gas and everything like that, so we have to be especially vigilant on the preparation to make sure there's absolutely no way that we can get a false positive or a false negative in those scans.
So really, whole body MRI, as good as it is, will struggle a bit with the smaller organs, and we can circumvent those limitations by doing dedicated scanning of the breast and the prostate.
Yeah, the other option that we're still exploring at the moment is lymph nodes. And we know that that's something with MRI. In the old days, they might look at the size of lymph nodes as being an indication of there being cancer, but we know these days that small lymph nodes can have early cancer changes. So that's where a lot of our progressive research going forward will be, to take that out of it as well. Looking at different layers of diffusion and also looking at other contrast agents to look up a functional test of lymph nodes to make normal acting lymph nodes maybe disappear and only non-normal functioning lymph nodes reappear. But this is something that's a work in progress at the moment.